Are the bioidentical hormones approved and regulated by FDA?
No. That's the thing. The big thing about this is anything that is compounded is basically regulated by the state boards of pharmacy. The FDA is currently looking towards it after what happened at the New England Compounding Center a year and a half ago. They are looking more into regulating, especially sterile compounding, but this type of compounding as well. But for now, basically, we purchase all of our chemicals from FDA inspected wholesalers. And you need to make sure that your compounding pharmacy does. We were recently accredited by PCAB. PCAB is a professional compounding, or excuse me, pharmacy compounding accreditation board. So this is basically, it gives you confidence that we're doing what it is that we're supposed to be doing. We're sending things out to be tested for potency so that you know that if we tell you this is a 25 milligram progesterone capsule, it's 25 milligram, it's not a 12.5 or a 13 milligram capsule. If we see that something is wrong with that, then we make adjustments to our formulas. So you just need to make sure that what is your compounding pharmacy doing, and how they're doing it, and how much experience do they have.
Okay. Why don't traditional doctors prescribe bioidentical hormones?
Traditional American College of Gynecology gynecologists have been taught by the American Menopause Society, which is heavily funded by Wyeth. But there's a lot of different things. Basically, it's what they're taught in school. And a lot of people just don't step outside and look at the different types of treatment modalities that there are. So we have to look at the person who's taking care of us and see if they are forward thinking and a little bit, if they're not stuck in med school.
Traditional medicine.
In traditional medicine. So you need to either go to A4M or, again, call your compounding pharmacy, because granted, on A4M there are there's a lot of different doctors, and you need some sort of screening tool to know, and the compounders will know the prescribing habits and know whether this practitioner is good, that practitioner is good. This one, all they want is money, because a number of these guys, they want you to come in every 2 to 3 months, and it's not that necessary. Initially, yes, but after a year or two of being on this, you don't need to come in every 2 to 3 months. So
yes.
Be careful with that too.
Yeah. So more doctors now are more leaning to be using bioidentical hormones.
Yes, I mean, when you've got dentists doing aesthetic practices like Botox and fillers, every doctor's looking for new avenues of revenue. I didn't mean for that to rhyme, but I did. But the whole point is everybody's looking, and there's a lot of people asking, and so a lot of doctors are seeing that I'm missing all of these patients because they're going to wind up going to somebody else because I don't do this.
Because they don't go to study something about the bioidentical.
Correct, and we have a lot of doctors who call me, and we help to train them.
Yeah. Oh,
yes.
Very interesting. Do I need prescription for the bioidentical hormones?
Yes. Every hormone and everything that a compounding pharmacy makes in Florida anyway is a prescription. That's not true in other states, but for the most part, hormones are prescription only. Even though you can see some of them in these over-the-counter products, it's kind of a gray area there.
So what is compound pharmacy? This is what you have here. What is compound pharmacy?
Well, compounding is the art of formulating different dosage forms and making custom formulas so that we can help patients' different needs. If a child doesn't like the flavor of their tablet, or their tablet is too big, we can change the flavors. We can take the tablet, crush it, suspend it, flavor it so that they like it. You know, like we initially said, gluten-free, casein-free. We can make things dye-free. We've got a lot of patients who are sensitive to dyes or who are vegans, and so we can use cellulose capsules with no dyes as opposed to the gelatin capsules. There's, you know, the sky's the limit with compounding. It is the art of, it's basically going back to the way it used to be in the very beginning. It's a chemist. It's
Yes.
mixing things up.
Mixing things up.
Yep.
Do I need to take these hormones forever?
It varies from patient to patient. You know, a lot of the traditional doctors will say, you know, 6 to 10 years would be a maximum. I have ladies in their
More than 10
I have ladies in their upper 80s that are still on it.
Oh,
So the whole point of the matter is in order to keep the levels where they were, when you were younger, you need to continually take them. You just have to be monitored. You know, I mean, can you stop it in 7 or 8 years? Sure. You stop it, and then you monitor. How do I feel? Things going downhill. You know, how's my skin look? My bone
wrinkles.
my bone scan. You know, are my bones still is at the same percentage? You start to notice things like that indicate the aging. Start taking them again.
Oh, okay. So I don't need to stop.
You don't need to stop yet. Just as long as you're monitoring.
I know. This is my last question. If I decide to start on the bioidentical hormone program, how much will be?
That varies. You've got, that's hard to say. You know, you've got different doctors out there charging anywhere from $150 to over $1,000 for the initial consult. Some of the ones that are higher, that includes the labs. So you gotta find out. There are still a few doctors that will actually accept insurance for doing this. Very few, but there are a few. And then as far as how much it costs, depends on what you're on, you know, what you need, because it can be as low as $35 a month, and it could be over $100 a month. It just depends on what you need and what other supplements, because granted, you know, you're not just the hormones. We have to look at the body as a whole, and if your adrenals aren't doing, we have to give you some adaptogenic herbs, rhodiola, ashwagandha, those sorts of things to help rejuvenate a fatigued adrenal gland. So it's all about the whole body. It's nutrition, it's diet, it's exercise.
Yeah.
It's everything. It's not just hormones.
Just the hormones.
Right.
Yeah.
It's not just the hormones. You've got to do the whole thing.
The whole balance of the whole body.
In order to feel your best.
Yes. Well, I would like to thank Dr. Chuck for this interview, and I hope so everybody will take something about this and learn. And I appreciate your time. Thank you.
Thank you.